Hello, I'm Dr. Collins, and in this episode, we're going to talk about low back pain. Why does your low back hurt? Stay tuned. Okay, so your low back hurts, right? You found this video. Why does your low back hurt? A lot of times, people are going to doctor's offices and they have intense low back pain that knocks them down. Sometimes people can't walk, they can't do things. Why are you feeling that low back pain? What is causing your low back pain, right? Often we go in and we get a script for some painkillers, or somebody's lining you up for surgery. We need to know what the cause of low back pain is so that we can really effectively treat it and get you back to doing what you want to do. So what causes low back pain? Well, similar to the neck, and if you haven't seen that video, I suggest that you do, and I'll link it in the description. But similar to the neck, you have nerve roots that leave the spine and go out to the body. So what do I mean by that? I'm going to use a neck model as an example. Similar to the neck, but down in the low back, you're going to have nerve roots that leave the spine. So the spine houses the nervous system. You have your main line, you have that spinal cord running down through the spine. At each level, at each segment of the vertebra, you're going to have nerve roots that exit the spine. So this is, the cervical spine, C0 through C7. But if you can imagine the lumbar spine, you're going to have a similar situation going on. So L1 through L5 in the lumbar vertebra, you're going to have nerve roots that are coming out and that are primarily running into the legs, the organs of the pelvis down below, the legs, the feet, the toes, that kind of stuff. So when you have irritation building up on those nerve roots over time, you can start to feel those nerves not acting properly. That could show up as pain, numbness and tingling, loss of sensation, hypersensation, stuff like that. You can also have motor weakness, which is the muscles. You can have weakness, drop foot, difficulty walking. Basically, those nerves are just not functioning properly. But why? So where does that dysfunction come from? Well, when the spine is compressed over time, so if you can imagine, you don't have a symmetrical spine, right? You have some abnormal loading and shifting happening through the spine. You can start to build up pressure and dysfunction, irritation on those nerve roots, and over time you start to damage them. And that's really when you see numbness and tingling, that's that beginning of damage, right? All the way to where you can end up in a situation like neuropathy, where the nerves are almost dead, okay? So over time, when you start to have that loading and compression abnormal, there's asymmetric, things are not properly balanced, there's not proper weight distribution through that system mechanically, you start to irritate those nerve roots. And that can feed a lot of pain. Beyond nerve pain, muscles are a huge component of low back pain, right? That's primarily what I see in here when I'm working with people. So whenever, and this may be a stretch if you haven't heard this before, and I suggest going back to the neck pain video, but it's truth. So whenever the atlas, whenever the top bone in the neck is displaced and the weight of the head is shifted over, it's going to cause the body to respond. So let me kind of model this, right? The head is slightly off axis because those bones are displaced. The body is going to compensate by tightening up in the low back to draw the entire upper body, shoulders, and head over to get the eyes back level with the horizon. This is not a big deal if it's temporary, a few days, maybe a couple weeks, but over months and years and decades, you can start to see wear and tear happening on those muscles, and you can see wear and tear happening and degeneration happening in the spine. So that's when you're talking about stuff like degenerative disc, arthritis problems, again, the nerve stuff that happens. Oh, I herniated a disc, I slipped a disc, stuff like that. And when you go in to get an MRI, you're seeing, a laundry list of names for this stuff, but it's just extended wear and tear on the spinal column because things have not been properly distributed with weight and you're having wear and tear. So how do you fix it, right? How do you fix low back pain, neck? Yes, you actually reset the position of the head on top of the spine. And in the same way that the body twisted and compensated to get those eyes level, when you release that, the body's able to start to open back up, allow those muscles to relax, and then that dysfunction and damage and spastic muscle stuff, all that stuff starts to release, and those muscles can start to heal. Same thing can happen with discs. Same thing can happen with nerves. They just take different periods of time for those tissues specifically to start to clean up and heal. So I hope this answered some of your questions about why you might have low back pain. If you have any more questions, feel free to check out our website, uppercervicalstewart.com, and don't forget to subscribe. Thank you.